of learning and care. Take a deep breath in, feeling calm enter your body. Exhale gently, releasing any tension. Today we're going to talk about preventing clogged pores, how to keep your pores clear and healthy through gentle, consistent practices rather than aggressive intervention. Clogged pores are at the root of many skin concerns: blackheads, whiteheads, acne, and rough texture. When pores become blocked with oil, dead skin cells, and debris, problems develop. But here's empowering news. Pore clogging is largely preventable through thoughtful daily habits and a gentle skincare routine. Let's begin by understanding what causes pores to clog. Your pores contain hair follicles and sebaceous glands that produce oil called sebum. This oil is natural and necessary. It protects and moisturizes your skin. Problems arise when too much oil is produced, when dead skin cells accumulate faster than they shed, or when external debris mixes with these and blocks the pore opening. Several factors contribute to clogged pores: excess oil production influenced by hormones, genetics, and stress; dead skin cell buildup from inadequate exfoliation or too rapid cell turnover; heavy or pore-clogging skincare and makeup products; inadequate cleansing that leaves residue on your skin; environmental pollutants that settle on your skin; and touching your face frequently, which transfers oil and bacteria. Understanding these causes helps you prevent them systematically. The foundation of pore clogging prevention is proper cleansing. Cleanse your face thoroughly once daily in the evening to remove oil, dead skin cells, makeup, sunscreen, and environmental debris that have accumulated. Use a gentle but effective cleanser appropriate for your skin type. For oily or combination skin prone to clogged pores, a gel cleanser with salicylic acid can be beneficial. Salicylic acid is oil-soluble and penetrates into pores, helping keep them clear. Use 0.5 to 2% concentration. Double cleansing in the evening helps ensure complete removal of all pore-clogging substances. Start with an oil-based cleanser or micellar water to dissolve makeup, sunscreen, and excess sebum. Follow with your regular water-based cleanser to remove any remaining residue. Cleanse thoroughly but gently. Massage your cleanser onto your skin for a full minute, giving it time to work. Pay attention to areas prone to clogging: nose, chin, forehead. Rinse completely with lukewarm water. However, don't over-cleanse. Cleansing more than once daily or using harsh cleansers can strip your skin, triggering more oil production and actually worsening pore clogging. Balance is key. Regular exfoliation prevents dead skin cell buildup that contributes to clogged pores. Chemical exfoliation with AHAs or BHAs is generally more effective and gentler than physical scrubs. Salicylic acid, BHA, is particularly effective for preventing clogged pores because it penetrates into pores and dissolves oil and debris. Use a salicylic acid treatment 2 to 4 times per week, depending on your skin's tolerance. This could be a toner, serum, or leave-on treatment with 0.5 to 2% salicylic acid. AHAs like glycolic or lactic acid exfoliate the skin surface, preventing dead cell accumulation. These work well for many skin types. Use 5 to 8% concentration 2 to 3 times weekly. Don't use multiple exfoliants at once or exfoliate daily unless your skin clearly tolerates it without irritation. Overexfoliation damages your barrier and can worsen your skin. Choose your skincare and makeup products carefully to avoid introducing pore-clogging ingredients. Look for products labeled non-comedogenic, which means they're formulated not to clog pores. Common pore-clogging ingredients to be cautious of include coconut oil, though some people tolerate it fine, certain silicones in high concentrations, heavy oils and butters, some waxes, and thick, occlusive formulas if you're very oily. However, ingredient sensitivity is individual. A product that clogs one person's pores might be fine for another. Pay attention to your own skin's response rather than universally avoiding ingredients. For pore-prone skin, choose lightweight formulas, gel or gel cream moisturizers rather than heavy creams, fluid or gel sunscreens rather than thick creams, and mineral makeup or lightweight liquid formulas rather than heavy, oil-based makeup. Remove makeup thoroughly every evening. Sleeping in makeup is one of the surest ways to clog your pores. No matter how tired you are, at minimum, remove your makeup with micellar water before sleep. Moisturize consistently, even if you have oily skin. Dehydrated skin can actually trigger more oil production and more pore congestion. Use an appropriate lightweight, non-comedogenic moisturizer that provides hydration without heaviness. Sun protection is essential, but choose your sunscreen wisely for pore-prone skin. Mineral sunscreens with zinc oxide work well for many people prone to clogged pores. Lightweight chemical sunscreens are also available. Find one that doesn't feel heavy or greasy on your skin. Lifestyle habits significantly affect pore health. Don't touch your face unnecessarily throughout the day. Your hands carry oil, dirt, and bacteria that transfer to your skin and contribute to clogged pores. Every touch is an opportunity for contamination. Keep everything that touches your face clean. Change your pillowcase at least twice weekly. Nightly if you're very prone to clogged pores. Use a clean towel to dry your face, or dedicate a small face towel that you wash frequently. Clean your phone screen regularly as it touches your face and harbors bacteria and oil. If you wear makeup, clean your brushes and sponges regularly, weekly at minimum. Dirty application tools harbor bacteria and reintroduce oil and old makeup to your skin, clogging pores. Avoid heavy, pore-clogging hair products near your hairline and face. Pomades, heavy styling creams, and thick conditioners can migrate onto your face, especially along your hairline and forehead, causing clogged pores and breakouts. Use lighter products or keep hair products away from your face area. Manage oil production through lifestyle factors. Stress increases cortisol, which triggers more sebum production. Whatever helps you manage stress, exercise, meditation, adequate sleep, relaxation practices, indirectly helps prevent clogged pores. Stay hydrated by drinking water consistently. When your body is well hydrated, your skin is better able to regulate its own oil and moisture balance. Eat a balanced diet. Some people find that dairy or high glycemic foods increase their oil production and pore clogging. If you suspect a dietary connection, try eliminating these foods for a month and observe whether your skin improves. Consider professional treatments if you're prone to persistent clogged pores, despite good home care. Regular facials with professional extraction by a trained esthetician can help keep pores clear. Professional chemical peels provide deeper exfoliation. Discuss these options with a licensed professional. Retinoids, either over-the-counter or prescription, are highly effective at preventing clogged pores by increasing cell turnover and preventing debris accumulation. If home remedies aren't sufficient, consult a dermatologist about whether retinoids might help. Maintain consistency with your prevention routine. Pores don't clog overnight, and keeping them clear requires daily attention to cleansing and regular exfoliation. The habits you build and maintain matter more than any single product or treatment. Be patient with results. Even with perfect prevention, occasional clogged pores may occur due to hormones, stress, or other factors beyond your control. Don't judge yourself or your routine based on occasional breakouts. Assess your skin over weeks and months, not days. Remember that some degree of visible pores is normal and natural. Pores are real structures in your skin that serve important functions. You're not aiming for invisible pores. That's not realistic or necessary. You're aiming for clear, unclogged pores that function properly. As we close, embrace this truth. Welcome and breathe deeply. Today we're expanding our focus beyond facial skincare to embrace your entire body. Your skin is one continuous organ deserving of care from head to toe. Most people spend considerable time and money on facial skincare while largely neglecting the skin on their bodies. But body skin faces many of the same challenges as facial skin: dryness, sun damage, aging, irritation, and deserves attention too. Your body skin is generally thicker and more resilient than facial skin, but it still needs moisture, protection, and care. Let's explore how to care for your body effectively without making it complicated or time-consuming. Let's start with cleansing your body. The way you shower or bathe significantly affects your skin. Hot water feels wonderful but strips your skin's natural oils, leading to dryness and irritation. Use lukewarm or warm water instead of hot. Your skin will thank you. Keep showers relatively brief. 10 minutes is adequate for cleansing without excessive drying. Long, hot showers are relaxing but dehydrating for your skin. Choose gentle body cleansers rather than harsh soaps. Many traditional bar soaps have a high pH that disrupts your skin's natural acid mantle. Look for soap-free cleansers, gentle body washes, or pH-balanced soaps. You don't need to vigorously scrub your entire body every day. Gentle cleansing with your hands or a soft washcloth is sufficient. Focus cleansing on areas that produce more oil and sweat: underarms, groin, feet. Other areas might only need water or very gentle cleansing most days. If you enjoy using a loofah or body brush, choose soft ones and replace them regularly as they harbor bacteria. Use gentle pressure. You're cleansing skin, not scrubbing a floor. Rinse thoroughly. Soap residue left on skin can cause irritation and dryness. Pat dry with a towel rather than rubbing vigorously. Leave your skin slightly damp. This is the perfect time to apply body lotion. Now let's talk about moisturizing your body, which is perhaps the most important step in body skincare. Immediately after showering, while your skin is still slightly damp, apply body lotion or cream. Damp skin absorbs moisturizer better, and the lotion helps seal in that moisture. Choose a body moisturizer appropriate for your skin type and needs. If you have very dry skin, look for rich body creams or body butters with ingredients like shea butter, cocoa butter, or thick oils. If you have normal to oily skin, lighter body lotions work well. If you have sensitive skin, choose fragrance-free, minimal ingredient formulas. Good body moisturizers contain humectants like glycerin or hyaluronic acid that draw moisture in, emollients like plant oils that smooth and soften, and occlusives like dimethicone or petrolatum that seal moisture in. Apply generously. Don't skimp on body lotion. Your body has a lot of surface area and needs adequate product. Use long, smooth strokes to apply, massaging it in gently. Pay special attention to areas prone to dryness: elbows, knees, hands, feet, and lower legs. These areas have fewer oil glands and tend to be drier. Make this a daily habit. Your body doesn't need moisturizer just in winter. It benefits from daily moisture year-round. If you have very dry skin or specific problem areas, you might consider different products for different needs. A rich cream for feet, a lighter lotion for your torso and arms, perhaps a specialized treatment for rough elbows or keratosis pilaris. Let's discuss exfoliation for body skin. Body skin benefits from regular exfoliation just like facial skin. This removes dead cells, prevents clogged pores, improves texture, and helps your moisturizer absorb better. Physical exfoliation with body scrubs can be more vigorous than facial exfoliation, since body skin is generally more resilient. Use body scrubs once or twice weekly in the shower. Choose scrubs with fine particles. Salt or sugar scrubs work well. Apply to damp skin, massage in circular motions, then rinse and follow with moisturizer. Dry brushing before showering is another exfoliation option. Using a natural bristle brush on dry skin, brush in long strokes toward your heart. This exfoliates, stimulates circulation, and may support lymphatic drainage. Follow with your shower and moisturizer. Chemical exfoliation for body skin can be very effective. Body lotions containing AHAs like lactic acid or glycolic acid help with rough texture, bumps, and keratosis pilaris, those small bumps on upper arms and thighs. Use these consistently for several weeks to see results. For feet specifically, you might need more intensive exfoliation. Pumice stones used on damp feet gently remove thick, dead skin on heels and soles. Be patient and gentle. Don't try to remove all thickness in one session. Now let's address sun protection for body skin. Just like your face, your body skin needs sun protection. Sun damage causes premature aging, dark spots, and increases skin cancer risk. Apply broad-spectrum SPF 30 or higher to all exposed body skin before going outside. This includes arms, legs, chest, back, hands, any area not covered by clothing. Reapply every 2 hours when outdoors, or more frequently if swimming or sweating. Clothing provides sun protection too. Tightly woven fabrics offer better protection than loosely woven ones. Some clothing is specifically rated for UV protection. Don't forget commonly missed areas: tops of feet, backs of hands, back of neck, ears. These areas get significant sun exposure and are prone to sun damage. If you spend lots of time outdoors, invest in proper sun protection. The money spent on sunscreen is far less than the cost of treating sun damage later. Let's talk about specific body skin concerns. Keratosis pilaris, those small, rough bumps on upper arms, thighs, or buttocks, is very common and harmless. It's caused by keratin buildup in hair follicles. Regular exfoliation with AHA lotions helps smooth the bumps. Be patient. Improvement takes weeks to months of consistent use. Moisturizing helps too. Don't pick or scratch the bumps. Body acne, particularly on back and chest, can be addressed similarly to facial acne. Use a gentle cleanser with salicylic acid. Wear loose, breathable clothing. Shower promptly after sweating. Use body lotions with acne-fighting ingredients. Change sheets regularly. If severe, see a dermatologist. Stretch marks are scars that form when skin stretches rapidly during growth spurts, pregnancy, or significant weight changes. They're permanent once formed, though they fade from red-purple to white-silver over time. No cream can eliminate existing stretch marks, though keeping skin well moisturized during periods of rapid stretching might help prevent severity. Prescription tretinoin might modestly improve appearance of newer stretch marks. Laser treatments can help with mature stretch marks, but won't eliminate them completely. Ingrown hairs occur when hair grows back into the skin instead of up and out. Exfoliation helps prevent them by removing dead skin cells that trap hair. Moisturize to keep skin supple. Don't pick at ingrown hairs. This can cause scarring and infection. If problematic, consider alternative hair removal methods or see a dermatologist. Dry, cracked heels need intensive care. Exfoliate with a pumice stone regularly. Apply thick, urea-based creams specifically for feet. Consider overnight treatments. Apply thick cream, then wear cotton socks to bed. Be patient and consistent. Let's discuss hand care specifically, since hands are
These theoretical relationships suggest acne patterns might shift with climate. Being adaptable in acne management as environmental factors change is prudent. Guide 83, Acne in the Digital Age, Social Media, Online Communities, and Misinformation. Social media and online communities have transformed acne experience. Understanding digital age acne realities helps navigate benefits and pitfalls. Social media's focus on flawless appearance increases appearance anxiety and acne-related distress for some. Comparing yourself to filtered, edited images causes unrealistic expectations and self-esteem damage. Curated social media images where people show only their clearest skin days or use heavy filtering distort reality. Recognizing that everyone has imperfect skin days helps maintain perspective. Online acne communities provide support, shared experiences, and practical advice. These communities normalize acne and reduce isolation. Misinformation about acne spreads rapidly online. Evaluating source credibility and distinguishing evidence-based information from marketing or myth is important. Online acne forums sometimes feature unverified treatment claims. Being skeptical of anecdotal stories and seeking professional guidance for unusual claims protects you. Telemedicine dermatology accessed online expands access to professional care, beneficial for those without nearby specialists. Online skin analysis apps using AI might provide useful guidance but shouldn't replace professional assessment. Limiting social media exposure, particularly comparing images, supports mental health during acne treatment. Guide 84, Acne Treatment in Resource-Limited Settings. Many people globally lack access to standard acne treatments. Understanding available low-cost options and treatment adaptations helps those with limited resources. Over-the-counter benzoyl peroxide and salicylic acid are often affordable and available globally, even in resource-limited settings. These should be first-line treatments where available. Local botanical treatments, tea tree oil, neem oil, honey, used traditionally sometimes have evidence supporting their use. These are often affordable and locally available. Oral antibiotics, generic doxycycline, tetracycline, are often inexpensive in resource-limited settings, making oral antibiotic treatment accessible. Isotretinoin might be unavailable in many countries due to cost or regulatory restrictions, limiting treatment for severe acne without this option. Professional dermatology care might be unavailable or prohibitively expensive. Training non-specialist healthcare providers in basic acne treatment helps extend care availability. Community health workers trained in acne management can provide guidance and treatment in areas lacking specialist dermatology. Telemedicine potentially extends access to professional dermatology even in resource-limited areas, though internet access is necessary. Simple, low-cost interventions, sun protection, hygiene, lifestyle optimization, remain effective even without expensive treatments. Guide 85, Acne and Gender, Sex-Specific Differences and Considerations. While acne affects all genders, sex-specific hormonal and social factors create gender differences in acne experience warranting gender-specific understanding. Female acne often involves hormonal cyclicity, often concentrating around menstrual cycle phases. Males lack this cyclicity, experiencing more constant acne patterns. Hormonal treatments, oral contraceptives, spironolactone, are standard for female acne but generally inappropriate for males. Males rely on topical treatments and antibiotics primarily. Female-specific acne considerations include menstrual cycle tracking, potential birth control side effects, and pregnancy precautions with acne medications. Male acne might be more severe on average due to higher baseline androgens. However, severe acne affects all genders. Facial hair in males makes treating acne challenging. Beard covers facial acne and prevents topical treatment application. Facial hair also traps moisture and bacteria. Some males benefit from beard care modifications or shaving strategy adjustments. Societal appearance pressure affects genders differently. While appearance standards affect all genders, women might face intensified appearance-focused judgment. Recognizing gender differences allows appropriate, gender-sensitive treatment approaches. Guide 86, Acne Scarring Prevention During Active Treatment. While scarring is addressed post-acne, prevention during active acne treatment is more effective than treating scars after they form. Preventing deep inflammation, which causes scarring, is paramount. Aggressive acne treatment preventing severe lesions prevents scarring more effectively than treating scars afterward. Avoiding picking, squeezing, or extracting acne is crucial for scarring prevention. This is perhaps the single most important scarring prevention strategy. Treating acne early prevents it from reaching severity levels causing scarring. Early intervention prevents worse scarring than treating established severe acne. Professional acne management, particularly using isotretinoin for severe acne, prevents deep inflammation that causes scarring. Waiting years trying home treatments before seeking professional help allows scarring to occur that could have been prevented. Post-inflammatory hyperpigmentation prevention through sun protection prevents darkening of healing acne that makes scars more visible. Barrier health maintenance during treatment prevents excessive irritation that might promote deeper inflammation and scarring risk. Understanding that scarring prevention is more effective than scar treatment motivates appropriate early intervention for severe acne. Guide 87, Acne and Beauty Standards, Challenging Appearance-Focused Culture. Acne exists within broader cultural beauty standard contexts. Understanding and challenging appearance-focused culture helps reduce acne-related distress. Beauty standards have varied historically and culturally, showing that current standards are culturally constructed, not universal truths. Overemphasis on flawless appearance in media and advertising creates unrealistic expectations. Recognizing that almost everyone has occasional skin imperfections helps maintain perspective. Influencer and celebrity appearance standards are curated through makeup, filtering, professional photography, and often procedures. Comparing yourself to these unrealistic standards damages self-esteem. Diverse beauty standards across cultures show multiple ways to be beautiful. Recognizing beauty beyond clear skin reduces acne's psychological impact. Challenging personal internalized beauty standards, recognizing you can be valuable and attractive with acne, reduces acne-related distress. Supporting others in valuing themselves beyond appearance helps shift culture away from appearance obsession. Advocating for more realistic, inclusive beauty standards in media reduces social pressure perpetuating appearance anxiety. Guide 88, Acne Treatment Adherence and Habit Formation Science. Understanding adherence and habit formation improves your ability to maintain treatment consistency long-term. Habits typically form through repetition. Repeating skincare routines consistently for 2 to 3 months makes them increasingly automatic, reducing conscious effort required. Environmental design supporting habits increases consistency. Placing skincare products visibly, creating dedicated skincare spaces, and removing friction, having products easily accessible, supports adherence. Cue-based habit formation, attaching skincare to existing habits like brushing teeth, increases consistency compared to time-based cues. Remember to do skincare. Reward associations with skincare, pleasant-smelling products, enjoyable ritual, positive reinforcement, increase adherence through positive conditioning. Accountability partnerships where you report to someone, friend, family, online community, increase consistency through social commitment. Motivation fluctuates. Understanding that motivation naturally varies and developing systems that work regardless of motivation, habit, routine, environment design, helps maintain adherence despite motivation fluctuation. Self-compassion toward occasional lapses prevents them from derailing entire routines. Missing a day occasionally. Treatments, typically 3 to 6, provide progressive improvement. Laser resurfacing works for all scar types but is most effective for shallow scars and ice pick scars. Dermal fillers inject material beneath scars to fill depressions temporarily. Different fillers last varying lengths, some last 6 months, others 1 to 2 years. This approach works well for ice pick and boxcar scars but requires repeat treatments. Filler results are immediate, making this attractive for short-term improvement. Microneedling creates controlled microinjuries, stimulating collagen production and remodeling scarred tissue. Multiple sessions, typically 4 to 6, provide progressive scar improvement. Microneedling works for all scar types and is relatively affordable compared to laser treatments. Chemical peels can improve shallow scars through repeated treatments. TCA, trichloroacetic acid, peels at medium depth can improve scar appearance, though results are less dramatic than laser or microneedling. Treatment selection depends on scar type, depth, and individual factors. Dermatologists typically recommend combination approaches, perhaps subcision combined with microneedling, or laser resurfacing combined with fillers. Severe, extensive scarring might warrant multiple treatment types performed sequentially. Realistic expectations are essential. Most scars can be significantly improved but rarely completely eliminated. Even after multiple treatments, mild scarring typically remains. However, significant improvement is usually achievable with appropriate treatments. Guide 13, Face Masks and Professional Facials for Acne Management. Face masks and professional facials supplement your daily skincare routine, providing concentrated treatments and professional expertise. Understanding various mask types and facial treatments helps you select appropriate options for your skin concerns. Clay masks absorb excess oil and impurities, making them ideal for oily, acne-prone skin. Green clay and kaolin clay are particularly effective. These masks draw out sebum, bacteria, and impurities from pores. Use clay masks 1 to 2 times weekly for 10 to 15 minutes on clean skin. Apply evenly, avoiding the eye area. As the mask dries, you'll feel slight tightening as oil is extracted. Rinse with lukewarm water and follow with moisturizer, as clay masks can be drying. Sheet masks infused with acne-fighting ingredients like salicylic acid, tea tree oil, or niacinamide provide targeted treatment and hydration simultaneously. Apply sheet masks to clean skin for 15 to 20 minutes, then remove and pat remaining serum into skin. Use 2 to 3 times weekly. Sheet masks are convenient, mess-free, and come in numerous formulations targeting specific concerns. Hydrating masks with hyaluronic acid, glycerin, or ceramides balance skin and prevent overdrying from acne treatments. These masks are essential if your acne treatment regimen is causing excessive dryness. Use hydrating masks 1 to 2 times weekly, particularly on days when you're using strong actives like retinoids or chemical exfoliants. Mud masks similar to clay masks draw impurities from pores while providing mineral content. Some formulations include additional active ingredients. Use similarly to clay masks, 1 to 2 times weekly for 10 to 15 minutes. Charcoal masks draw impurities from deep within pores. While popular, they can be overly drying. Use sparingly, perhaps monthly, if you have very oily skin. Avoid if your skin is dry or sensitive. Overnight masks are left on overnight and act as intensive treatments. Some are essentially very rich moisturizers, while others contain actives like retinol or acids. These work well for providing intensive treatment without time constraints. Apply as your final nighttime step and sleep with the mask on. Spot masks apply highly concentrated treatments to specific areas rather than your entire face. These are useful when some areas are more problematic than others. Apply to clean skin and leave on as directed. Important mask principles. Never use multiple mask types on the same day. Choose one mask per skincare session. Always follow mask application with appropriate moisturizer, as masks can be drying. Start with masks once weekly, increasing frequency only as your skin demonstrates tolerance. Don't leave masks on longer than recommended. Longer application doesn't mean better results and risks overdrying. Masks are supplements to your core routine, not replacements for daily cleansing and treatment. Professional facials go beyond at-home masks, utilizing professional strength products, specialized equipment, and esthetician expertise. A typical acne-focused facial includes cleansing, exfoliation, extraction, treatment mask, and moisturizer application. The extraction component, professional removal of comedones, provides benefits impossible to achieve safely at home. Hydrofacial uses suction technology to extract impurities from pores without harsh manual extraction. A spiral tip applies suction while simultaneously infusing treatment serums. Hydrofacials provide immediate visible improvement, particularly for comedones. Most people see results after a single treatment. cumulative benefits after 4 to 6 treatments performed monthly. Chemical peel facials use professional strength acids, glycolic acid, salicylic acid, or lactic acid, to exfoliate multiple skin layers. Superficial peels cause mild redness and slight flaking but require no downtime. Medium peels cause more significant exfoliation and require several days of recovery. Chemical peels improve acne, texture, and hyperpigmentation significantly. Monthly superficial peels or quarterly medium peels provide excellent results. Blue light therapy facials use specific light wavelengths to kill acne-causing bacteria. Blue light, around 415 nanometers wavelength, is particularly effective against Cutibacterium acnes. Treatments typically last 15 to 20 minutes. Most treatment plans include 6 to 8 sessions, sometimes combined with red light therapy for inflammation reduction. Blue light therapy is particularly valuable for those seeking non-chemical treatment or for bacterial acne resistant to other treatments. Microdermabrasion facials use fine crystals or a diamond tip to physically exfoliate skin. This removes dead skin cells, unclogs pores, and stimulates collagen production. Results are immediate visible skin smoothing. Regular microdermabrasion, monthly, maintains clear skin and improves texture. Oxygen facials infuse pressurized oxygen with serums deep into skin. While marketed aggressively, evidence for exceptional benefits is limited. However, many people report improved hydration and glow after oxygen facials. Dermaplane facials use a sterile blade to remove fine facial hair and dead skin cells. This provides exfoliation and hair removal simultaneously. Results are immediate, smooth, bright skin. However, dermaplane isn't appropriate for acne-prone or actively inflamed skin, as the blade can irritate lesions. Laser facials use laser technology for exfoliation, collagen stimulation, and targeted treatment of specific concerns. Fractional laser facials are gentler than full laser resurfacing and provide results with minimal downtime. Professional facials are most effective when combined with consistent home skincare. Monthly professional treatments combined with daily consistent routines in consistent order reduce sensory overwhelm. Number 50 Specialized Skin Care and Acne Treatment Guides, Part 4. Each guide, 10 to 15 minutes reading time. Guide 51, Acne During Menstrual Cycle, Tracking, Prediction, and Strategic Treatment Timing. Understanding how your menstrual cycle affects acne allows you to predict breakouts and strategically time treatments for maximum effectiveness. This is particularly valuable for women with cyclical hormonal acne. For confirmed acne cosmetica, switching to acne-safe alternatives of the product category often resolves the issue. Switching to non-comedogenic foundations, powder-based makeup instead of cream-based, or lighter formulations often allows makeup use without acne worsening. Reading ingredient lists helps identify potentially problematic components. Becoming familiar with ingredients triggering your personal acne helps you avoid them. Some people maintain lists of problematic ingredients to check against when considering new products. Patch testing new products on a small area, behind your ear or on your jaw, before full face application helps identify problematic products before they cause widespread acne. This 1 to 2 week trial prevents wasting money on products that trigger acne. The relationship between acne cosmetica and other acne factors is important. Someone might have both hormonal acne, from internal factors, and acne cosmetica, from products. Addressing both simultaneously, using acne-safe products plus treating hormonal acne medically, provides the best outcomes. Makeup artists and dermatologists can recommend acne-safe product alternatives for people who require makeup professionally. Many professional-grade acne-safe makeup lines exist specifically for people needing makeup without triggering acne. Guide 53, Acne Mechanica, Friction and Pressure-Related Acne. Acne mechanica results from friction, pressure, or occlusion of skin and can be prevented through environmental and behavioral modifications. Understanding acne mechanica helps you prevent this preventable form of acne. Acne mechanica appears where friction or pressure occurs, under helmet straps, where backpack straps compress skin, where tight athletic equipment contacts skin, or where repetitive hand-face contact occurs. This acne is localized to pressure-bearing areas rather than distributed across the face. Friction from repetitive skin-on-surface contact, athletes rubbing faces on towels, workers constantly resting their faces on hands, can trigger acne through mechanical irritation and follicle disruption. Occlusion, trapping sweat and bacteria under non-breathable materials, creates ideal conditions for acne. Wearing tight, non-breathable clothing or equipment increases acne in that area. Prevention strategies include wearing loose, breathable clothing, ensuring athletic equipment is clean, using protective barriers, adhesive taping where possible, between skin and friction sources, and maintaining good hygiene in high-friction areas. Post-exercise hygiene is crucial for athletes. Showering immediately after exercise, changing into clean clothes, and cleansing areas where equipment contacted skin helps prevent friction acne. Some athletes find that using antiperspirant before exercise reduces sweat-related friction and bacterial growth. Hairstyles causing friction, tight braids, tight buns, can trigger acne on the scalp and forehead. Occasionally loosening hairstyles, using gentler hair-holding methods, or alternating hairstyles reduces friction acne. Phone contact with your face transfers bacteria and causes friction acne on the jawline and cheek. Using earbuds or speakerphone when possible, cleaning your phone screen regularly, and taking breaks from phone use reduce this contact-related acne. For occupational friction acne, workers in certain industries, workplace modifications and protective equipment prevent acne. Ensuring clean, breathable protective equipment and maintaining good hygiene at work helps control occupational friction acne. Acne mechanica is often preventable through simple environmental modifications. Unlike acne requiring medications, friction acne responds to preventing the friction. This makes acne mechanica particularly frustrating when it occurs since prevention is often simpler than treatment. Guide 54, Drug-Induced Acne and Medication Side Effects. Certain medications trigger or worsen acne as a side effect. Recognizing drug-induced acne allows you to work with prescribers to modify medications or manage acne while necessary medications are continued. Corticosteroids commonly trigger acne or worsen existing acne. Systemic corticosteroids, oral, are more likely to cause acne than topical steroids, though topical steroids applied to face can also trigger acne. Patients on chronic systemic corticosteroids often experience significant acne requiring aggressive treatment. If corticosteroids are necessary, combining them with acne treatment is often required. Lithium, used for bipolar disorder treatment, causes acne in many patients. The mechanism involves effects on follicular epithelium and sebaceous gland function. Acne from lithium is sometimes severe. Working with your psychiatrist on whether alternative mood stabilizers are possible, or combining lithium with aggressive acne treatment, might be necessary. Anabolic steroids cause severe acne in nearly everyone using them. Anabolic steroid use for performance enhancement causes acne that often requires isotretinoin for management. The acne is typically severe, widespread, and on the trunk as well as face. Hormonal contraceptives can either improve or worsen acne depending on the specific formulation. Progestins with androgenic properties, like levonorgestrel or norgestrol, might worsen acne, while progestins with minimal androgenic activity, like norgestimate or drospirenone, often improve acne. If birth control is worsening acne, switching to a formulation with less androgenic progestin often helps. Anti-seizure medications sometimes worsen acne through various mechanisms. Working with your neurologist if seizure medications are worsening acne might identify alternatives or necessitate aggressive acne management. Vitamin B12 supplementation can paradoxically worsen acne in some individuals through unknown mechanisms. If you take B12 supplements and notice acne worsening, discontinuing B12 might help. The menstrual cycle consists of phases with distinct hormonal profiles affecting acne. The menstrual phase, days 1 to 5, involves shedding of uterine lining with declining hormone levels. Many women experience least acne during this phase as hormones are low. The follicular phase, days 6 to 14, involves increasing estrogen as follicles develop. Estrogen rise typically improves skin as estrogen has protective effects. Many women notice clearest skin during this phase. Ovulation, day 14, involves hormonal surge of LH and FSH. Some women experience minor acne worsening around ovulation. The luteal phase, days 15 to 28, involves rising progesterone and maintained estrogen. This phase often brings worsening acne in hormone-sensitive women due to progesterone effects and androgen to estrogen ratio changes. Tracking your acne patterns against your menstrual cycle for 2 to 3 months reveals your personal pattern. Many women find breakouts clustered in the luteal phase, particularly the 5 to 7 days before menstruation. However, individual patterns vary significantly. Some women have no cyclical acne pattern, while others have severe luteal phase breakouts. Once you identify your cyclical pattern, strategic treatment timing can optimize results. If you break out mainly in the luteal phase, intensifying acne treatment frequency during this phase can prevent significant breakouts. For example, if you normally use salicylic acid 2 to 3 times weekly, you might increase to daily use during your high-risk luteal phase. This temporary intensification often prevents the severe breakouts that would otherwise occur. Planning professional treatments around your cycle optimizes results. Having a chemical peel or professional facial during your clear follicular phase when your skin is less inflamed and more resilient provides better results than during your breakout-prone luteal phase. Hormonal contraceptives can help by suppressing ovulation and stabilizing hormone levels. Many women find that switching to birth control pills with continuous hormone dosing, tricyclic or extended cycle pills that reduce or eliminate placebo weeks, significantly reduces cyclical acne by preventing the hormonal fluctuations driving breakouts. Spironolactone, anti-androgen, helps some women with cyclical acne by blocking androgen effects. However, effects are more modest for pure cyclical acne than for chronic hormonal acne. Dietary modifications might help cyclical acne through hormone metabolism. Some evidence suggests that supporting liver health through adequate nutrients supports estrogen metabolism. Consuming adequate B vitamins, magnesium, and fiber supports hormone metabolism. PMS supplements containing ingredients like calcium, magnesium, and vitamin B6 might help with luteal phase acne through their effects on hormone metabolism and inflammation. Some women find these supplements modestly helpful. Stress during the luteal phase exacerbates acne in many women. The luteal phase naturally involves slightly increased anxiety and mood sensitivity. Implementing additional stress management during this phase, extra exercise, meditation, or relaxation practices, can reduce acne by controlling stress hormonal interactions. Sleep quality often decreases in the luteal phase due to progesterone effects. Prioritizing sleep during this phase through good sleep hygiene, potentially with earlier bedtimes, supports skin health. Understanding your cyclical acne pattern allows realistic expectations and strategic planning. Rather than being frustrated by predictable breakouts, you can anticipate them and proactively manage them. This empowerment often improves both skin outcomes and psychological well-being around acne. Guide 52, Acne Cosmetica, Product-Induced Acne and Ingredient Avoidance. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. Understanding this condition and identifying problematic ingredients prevents wasted time and money on ineffective acne treatments when the actual problem is product-induced acne. Acne cosmetica differs from typical acne in that stopping the offending product often resolves it completely, whereas typical acne persists despite good skin care. This distinction is diagnostically important. If your acne improves dramatically after discontinuing a specific product, acne cosmetica was likely the cause. Common culprits in acne cosmetica include foundations, particularly heavy, silicone-based ones, primers, concealer, powders, sunscreen, and heavy moisturizers. These products can clog pores through their occlusive nature or irritating ingredients. Specific ingredients commonly triggering acne cosmetica include dimethicone.
Welcome to this soothing moment of care. Breathe gently, allowing calm to fill you. Today we discuss calming irritated or reactive skin, how to care for skin that feels easily bothered, red, or uncomfortable with the utmost gentleness and understanding. Irritated or reactive skin can feel frustrating and uncomfortable. Your skin might sting when you apply products, become red easily, feel tight or itchy, or react to things that never bothered it before. This reactivity often signals a compromised skin barrier or increased sensitivity, and it needs gentle, thoughtful care. First, understand that reactive skin is often a temporary condition that can improve, not necessarily a permanent skin type. Many factors can cause skin to become reactive: overexfoliation, harsh products, environmental stress, allergic reactions, hormonal changes, stress, or illness. Identifying and removing triggers while supporting your barrier can restore your skin's resilience. The immediate priority when your skin is irritated is to simplify drastically and remove all potential irritants. Strip your routine down to bare essentials: a very gentle cleanser, a bland moisturizer, and sunscreen. Everything else must stop temporarily. Remove all active ingredients. Stop retinoids, acids, vitamin C, and any other treatment products. These are too stimulating for irritated skin right now. You'll reintroduce them later, one at a time, once your skin has calmed. Stop all exfoliation, whether physical or chemical. Your skin cannot rebuild its protective barrier while you're removing layers. No scrubs, no acids, no exfoliating tools. Discontinue any products with fragrance, essential oils, alcohol, or other known irritants. Even natural ingredients can irritate compromised skin. Choose fragrance-free, minimal ingredient products. For cleansing, use an extremely gentle, creamy cleanser or even just rinse with lukewarm water for a few days if cleansing seems to worsen irritation. When you do cleanse, use only your fingertips with the softest touch. Rinse thoroughly with lukewarm water, never hot, and pat dry gently. Consider oil cleansing if your skin tolerates it. Some irritated skins respond well to gentle oil-based cleansers that don't strip or foam. After cleansing, immediately apply soothing, barrier-repairing products to damp skin. The best ingredients for calming reactive skin include Centella asiatica, which reduces inflammation and supports healing, niacinamide at 2 to 5%, which strengthens barrier and reduces sensitivity, ceramides, cholesterol, and fatty acids to rebuild your barrier's structure, colloidal oatmeal, which soothes and reduces irritation, allantoin, which is calming and healing, and Meaty casicide and other calming botanical extracts. Look for products specifically formulated for sensitive or compromised skin. These typically have shorter ingredient lists with proven soothing components and no unnecessary irritants. Apply your soothing moisturizer generously. Don't skimp. Your irritated skin needs abundant hydration and barrier support. Reapply during the day if your skin feels tight or uncomfortable. Consider adding a facial oil as a final step to seal in moisture and provide extra barrier support. Oils like squalane, sunflower, or rosehip are generally well tolerated and nourishing. At night, you might apply an occlusive like petroleum jelly over your moisturizer on particularly irritated areas. This seals everything in and provides a protective barrier while your skin repairs overnight. Sun protection remains essential even for irritated skin. Choose a gentle mineral sunscreen with zinc oxide and titanium dioxide, which tend to be less irritating than chemical sunscreens. Apply it carefully over your moisturizer. Special soothing techniques. Apply cool compresses for immediate relief. Soak a soft cloth in cool water, wring out excess, and hold gently against irritated areas for 5 to 10 minutes. This reduces inflammation and provides instant comfort. Use hydrating mists throughout the day if your skin feels dry or uncomfortable. Follow immediately with moisturizer to seal in the hydration. Consider using a humidifier, especially while sleeping. Moist air helps prevent your skin from becoming further dehydrated. Avoid all potential triggers while your skin heals. Don't experiment with new products. Don't touch your face unnecessarily. Avoid very hot showers or baths. Protect your face from extreme weather, wind, cold, or intense sun. Keep everything that touches your face scrupulously clean. Use a fresh pillowcase nightly. Use a clean, soft towel each time you wash your face. Avoid makeup if possible while your skin is very irritated. If you must wear makeup, choose mineral makeup with minimal ingredients and remove it very gently in the evening. Lifestyle factors affect reactive skin significantly. Manage stress, which increases inflammation and sensitivity throughout your body. Practice calming activities, meditation, gentle yoga, deep breathing, time in nature. Sleep adequately. Your skin repairs itself during sleep, and adequate rest supports healing and reduces inflammation. Stay hydrated internally. Drink water consistently throughout the day to support your skin's healing processes. Eat anti-inflammatory foods, fatty fish, berries, leafy greens, nuts. Avoid foods you know trigger inflammation in your body. Avoid alcohol and excessive caffeine, which can increase inflammation and dehydrate your body. Identify and avoid triggers. If certain products always irritate your skin, avoid them permanently. If seasonal changes trigger reactivity, prepare by adjusting your routine preemptively. If stress causes flares, prioritize stress management. Keep a skin diary noting what products you use, what you eat, stress levels, and how your skin responds. Patterns often emerge that help you identify specific triggers. Patch test new products before applying to your entire face, even after your skin is calmed. Apply a small amount to your inner forearm or behind your ear for several days. If no reaction occurs, try it on a small area of your face before full application. Reintroduce products slowly once your skin has calmed. After several weeks of simplified care, if your skin feels comfortable and looks healthy, you can carefully reintroduce products one at a time. Wait at least a week between additions to identify any that cause problems. Be cautious about reintroducing actives. When your skin is ready, start with the lowest concentration and use just once or twice weekly initially. Many people find they can't return to their previous frequency of active use. Their skin has shown them it needs gentler treatment going forward. When to seek professional help. If your irritation is severe, painful, or persistent despite gentle care. If you develop signs of infection, increasing pain, warmth, pus, if you suspect an allergic reaction, intense itching, hives, swelling, or if your skin isn't improving after several weeks of simplified care, consult a dermatologist. Some skin conditions like rosacea, seborrheic dermatitis, or eczema cause chronic reactivity and require professional diagnosis and treatment. Remember that healing takes time. Mildly irritated skin might calm within days. More severely compromised skin can take weeks to months to fully repair. Be patient and consistent with your gentle care. As we close, embrace this truth. Reactive skin needs gentleness above all else. Simplify drastically. Support your barrier. Remove all irritants and give your skin time to heal. Your patience and tenderness will be rewarded. May your reactive skin calm and heal. May you identify and avoid your triggers. May you treat your skin.
Appearance-related anxiety helps reframe negative thoughts about acne, reducing anxiety and depression related to appearance. Specialized dermatology (CBT) combines skin condition understanding with psychological techniques for optimal outcomes. Acceptance and Commitment Therapy (ACT) helps people accept current skin status while committing to valued activities despite appearance concerns. This approach reduces appearance-focused anxiety while maintaining motivation for treatment. Body image work addressing distorted thinking about appearance supports mental health alongside medical treatment. Body dysmorphic disorder screening is important for those with disproportionate appearance distress. Mindfulness practices reduce appearance-focused anxiety and rumination, supporting mental health during treatment. Dermatology apps using AI analyze skin photos to assess acne severity, identify acne types, and recommend treatments. While some apps show reasonable accuracy for basic assessments, they can't match professional dermatologists for complex cases. These apps serve best as supplements to professional care rather than replacements. Accuracy of AI skin analysis varies. Higher quality apps with larger training datasets and professional validation generally perform better than those lacking proper development. However, all AI assessments have limitations and should be verified by professionals. Personalization algorithms use your skin characteristics, responses to past treatments, and various data points to recommend optimized treatment approaches. As these systems improve and accumulate more treatment outcome data, personalization effectiveness likely improves. Currently, these tools remain supplements to professional judgment rather than replacements. Telemedicine AI-assisted dermatology allows remote consultations where AI supplements the dermatologist's assessment. This can improve access to dermatology for people without nearby specialists. Privacy considerations are important with AI skincare apps. Your skin data is sensitive. Understanding how your data is used and stored matters when choosing AI tools. Guide 44: Peptide Therapies and Bioidentical Hormone Treatments. Advanced peptide therapies and bioidentical hormone treatments represent frontier approaches for acne management. Understanding these options helps you discuss them with your healthcare provider. Specific peptides stimulate collagen production and support skin barrier healing. For acne management, peptides primarily support post-acne recovery and scar treatment rather than treating active acne directly. Peptides appear in many premium skincare products. Bioidentical hormone replacement therapy, BHRT, uses hormones chemically identical to your body's natural hormones. For hormonal acne, bioidentical estrogen and progesterone might theoretically provide benefits similar to synthetic hormones in oral contraceptives with theoretically better tolerability. However, evidence for BHRT's superiority for hormonal acne is limited. Additionally, BHRT is more expensive and requires more individualized monitoring than standard hormonal contraceptives. Compounded bioidentical hormone prescriptions allow customization of hormone dosing and ratios. For severe hormonal acne, compounded BHRT might be appropriate, though professional oversight is essential. Guide 45: Nanotechnology in Acne Treatment. Nanotechnology enables delivery of active ingredients at microscopic scale for potentially enhanced effectiveness. Understanding nanodelivery systems helps you evaluate next-generation acne products. Liposomal formulations encapsulate active ingredients in microscopic lipid spheres, enabling enhanced penetration and stability. Liposomal retinol or liposomal benzoyl peroxide potentially provide enhanced effectiveness with reduced irritation through optimized delivery. Products using liposomal technology are increasingly available commercially. Nanoparticles of active ingredients increase surface area and bioavailability, potentially enhancing effectiveness. Nano-sized acne actives are being researched for enhanced skin penetration and efficacy. Sustained-release nanotechnology enables gradual release of actives over extended periods, potentially maintaining consistent therapeutic levels with less frequent application. Guide 46: Environmental and Climate Adaptation Strategies for Acne. Acne management must adapt to different climates and environmental conditions. Understanding climate-specific strategies optimizes treatment across varying conditions. Tropical climates with heat and humidity increase sebum production and bacterial growth. Strategies include more frequent cleansing, lighter formulations, focus on oil control, increased sun protection, sun worsens heat-related acne, air conditioning when possible, and increased frequency of active acne treatments. Guide 50: Acne Success Stories, effective patterns, and realistic timelines for clear skin. Examining successful acne treatment patterns and realistic timelines helps set expectations and maintain motivation during treatment journeys. Most people achieve significant acne improvement, 70 to 80% clearing, within 12 weeks with appropriate treatment. Complete clearance often takes 4 to 6 months. Severe acne or scarring might require 6 to 12 months or longer. Successful patterns often involve early professional intervention for moderate severe acne, combination approaches addressing multiple acne factors, consistent routine adherence, lifestyle optimization alongside treatments, patience through initial adaptation phases, and adjustment of treatments based on response. Common obstacles in achieving success include unrealistic expectations for overnight results, giving up after 4 to 6 weeks before full benefits appear, switching treatments too frequently before adequate trial period, neglecting lifestyle factors, inconsistent treatment adherence, and failing to pursue professional help when home treatment insufficient. Inspiring success often involves recognizing that clear skin is achievable through consistent, appropriate treatment. Most acne-prone individuals can achieve clear or nearly clear skin through proper dermatological care combined with appropriate skincare and lifestyle optimization. The ultimate lesson: acne is treatable. Whether your path involves topical treatments, professional treatments, hormonal interventions, or isotretinoin, solutions exist for your specific acne. Finding the right approach for your individual situation, maintaining patience and consistency, and persisting through initial difficulties. 50 Specialized Skin Care and Acne Treatment Guides, Part 4. Each guide, 10 to 15 minutes reading time. Guide 51, Acne During Menstrual Cycle, Tracking, Prediction, and Strategic Treatment Timing. Understanding how your menstrual cycle affects acne allows you to predict breakouts and strategically time treatments for maximum effectiveness. This is particularly valuable for women with cyclical hormonal acne. The menstrual cycle consists of phases with distinct hormonal profiles affecting acne. The menstrual phase, days 1 to 5, involves shedding of uterine lining with declining hormone levels. Many women experience least acne during this phase as hormones are low. The follicular phase, days 6 to 14, involves increasing estrogen as follicles develop. Estrogen rise typically improves skin as estrogen has protective effects. Many women notice clearest skin during this phase. Ovulation, day 14, involves.
Welcome, and take a moment to settle into this peaceful space. Breathe deeply and let go of any tension. Today we're going to explore one of skincare's most celebrated hydrating ingredients, hyaluronic acid. The name might sound intimidating. Acid can evoke thoughts of harsh, aggressive treatments. But hyaluronic acid is nothing like that. It's one of the gentlest, most hydrating ingredients you can use on your skin. In fact, it's already naturally present in your body, making it wonderfully compatible with your skin. Let's begin by understanding what hyaluronic acid actually is and why it's so remarkable. Hyaluronic acid is a molecule that your body naturally produces and uses in various tissues, including your skin, joints, and eyes. Its superpower is its ability to hold water, an astonishing amount of water. One molecule of hyaluronic acid can hold up to 1,000 times its weight in water. Imagine that. A single molecule acting like a tiny sponge, attracting and retaining moisture. In your skin, natural hyaluronic acid helps maintain hydration, plumpness, and suppleness. It fills the spaces between collagen and elastin fibers, creating a cushioned, hydrated environment where your skin cells can thrive. When your skin has adequate hyaluronic acid, it looks plump, smooth, and radiant. Unfortunately, as you age, your natural production of hyaluronic acid decreases. Starting in your 20s and accelerating through your 30s and beyond, your skin gradually produces less of this vital molecule. This is one reason why skin tends to look less plump and more dehydrated as we age. The good news? You can supplement your skin's hyaluronic acid through topical application, helping restore that youthful hydration and plumpness. Now let's talk about what hyaluronic acid does when you apply it to your skin. First and foremost, it's a humectant. Humectants are ingredients that attract water from their surroundings and bind it to your skin. When you apply hyaluronic acid, it draws moisture from the air and from deeper layers of your skin, bringing hydration to the surface where you can see and feel the benefits. This immediate hydrating effect is why hyaluronic acid feels so instantly gratifying. Within minutes of application, your skin feels more supple, looks more plump, and appears more radiant. This isn't just superficial. You're actually increasing the water content in your skin. Hydrated skin functions better in every way. When your skin cells are properly hydrated, they can carry out their normal processes more efficiently. Cell turnover improves, barrier function strengthens, and even oil production can normalize. Hydration is truly foundational to healthy skin. Second, hyaluronic acid helps reduce the appearance of fine lines and wrinkles. When your skin is dehydrated, fine lines become more prominent. Think of a plump grape versus a raisin. Both are the same fruit, but one has lost its water content and become wrinkled. By flooding your skin with hydration, hyaluronic acid temporarily plumps up those fine lines, making them less visible. This is especially noticeable around the eyes and mouth, where expression lines tend to form. While this effect is temporary, the hyaluronic acid must be reapplied regularly to maintain results. With consistent use, you can maintain that plumped, smooth appearance. Third, hyaluronic acid supports your skin barrier. A well-hydrated barrier is a strong barrier. When your skin is adequately hydrated, the lipids and cells that make up your barrier can arrange themselves properly, creating better protection against environmental stressors and reducing water loss. Think of your skin barrier like a brick wall. If the bricks are dry and brittle, the wall is weak. But if they're well maintained and properly moisturized, the wall is strong and protective. Hyaluronic acid helps keep those bricks in optimal condition. Fourth, hyaluronic acid has a soothing effect on the skin. While it's not specifically an anti-inflammatory ingredient, the act of deeply hydrating your skin can reduce irritation and discomfort. Dehydrated skin is often sensitive, tight and uncomfortable. Restoring hydration naturally calms these sensations. Fifth, hyaluronic acid works for every skin type. Whether you have dry, oily, combination, sensitive, or mature skin, hyaluronic acid offers benefits. It's lightweight and non-greasy, making it perfect for oily skin. It provides deep hydration that dry skin desperately needs. It's gentle enough for sensitive skin, and it addresses the dehydration that comes with aging. This universal compatibility is one reason hyaluronic acid has become such a staple in skincare. It's rare to find an ingredient that truly works for everyone, but hyaluronic acid is one of them. Now, let's talk about molecular weight and why it matters when choosing hyaluronic acid products. Hyaluronic acid comes in different molecular sizes: high molecular weight, medium molecular weight, and low molecular weight. Each size has different properties and benefits. High molecular weight hyaluronic acid has large molecules that sit on top of your skin. They can't penetrate deeply, but they create a beautiful, hydrating film on your skin's surface. This surface hydration feels immediately comfortable and helps prevent water loss. It's like placing a moisture-locking blanket over your skin. Low molecular weight hyaluronic acid has smaller molecules that can penetrate more deeply into your skin. They deliver hydration to deeper layers, providing more lasting effects and working from within to plump and hydrate. Many modern hyaluronic acid products use a blend of different molecular weights, giving you both immediate surface hydration and deeper, longer-lasting effects. This is ideal because you get the instant gratification of surface moisture, plus the cumulative benefits of deep hydration. When shopping for hyaluronic acid products, look for those that specify they use multiple molecular weights or list different forms like sodium hyaluronate, which is a salt form of hyaluronic acid with smaller molecular size. Let's discuss how to use hyaluronic acid effectively in your routine. Timing is important with hyaluronic acid because it's a humectant that draws water from its surroundings. You want to apply it when there's moisture available to draw. This means applying it to damp skin. After cleansing, while your skin is still slightly damp, is the perfect time to apply hyaluronic acid. That surface moisture gives the hyaluronic acid water to bind to. If you apply it to completely dry skin, it might actually draw water from deeper layers of your skin, which can be counterproductive. Some people like to mist their face with water or a hydrating toner before applying hyaluronic acid, then mist again after. This sandwich technique ensures there's plenty of water for the hyaluronic acid to grab onto. After applying hyaluronic acid, it's crucial to seal it in with a moisturizer. Remember, hyaluronic acid is a humectant, not an occlusive. It draws water to your skin, but doesn't prevent it from evaporating away. You need to lock in that hydration with a cream or lotion that contains occlusive ingredients. Think of it as filling a bucket with water, hyaluronic acid bringing hydration, and then putting a lid on it. moisturizer preventing evaporation. Both steps are necessary for optimal hydration. You can use hyaluronic acid both morning and night. It layers beautifully under sunscreen in the morning and under heavier night creams in the evening. Many people apply it after cleansing and toning, before serums and moisturizers. Hyaluronic acid is also available in different product types: serums, essences, moisturizers, and even sheet masks. Serums tend to have higher concentrations and allow for more precise layering with other products. Moisturizers with hyaluronic acid give you hydration and occlusion in one step, which is convenient. The concentration of hyaluronic acid in products typically ranges from 0.1% to 2%. You don't need extremely high concentrations to see benefits. Even lower percentages are effective when formulated properly. One important consideration: climate matters when using hyaluronic acid. In humid environments, hyaluronic acid has plenty of water vapor in the air to draw from, making it extremely effective. But in very dry environments, think desert climates or heated indoor spaces in winter, there may not be enough moisture in the air for hyaluronic acid to bind. In these dry conditions, hyaluronic acid might draw water from deeper layers of your skin instead of the environment, potentially leading to increased dehydration. The solution is simple. Use a humidifier to add moisture to the air. Apply hyaluronic acid to damp skin with an occlusive moisturizer on top, or consider using it in combination with other hydrating ingredients that work differently. Are there any downsides to hyaluronic acid? Very few. It's extremely well tolerated, and allergic reactions are rare. Some people with very sensitive skin might react to certain formulations, but this is usually due to other ingredients in the product rather than the hyaluronic acid itself. One thing to be aware of: some lower quality hyaluronic acid products can feel sticky or pill up under other products. This is usually a formulation issue, not a problem with hyaluronic acid itself. If you find your product feels uncomfortable, try a different brand. Hyaluronic acid also works beautifully with other ingredients. It's compatible with virtually everything: vitamin C, retinol, niacinamide, AHAs, BHAs. It can actually help buffer potentially irritating ingredients, making them more tolerable. Let's address some common questions about hyaluronic acid. Can you use too much? Not really. Your skin will absorb what it can use, and the rest will sit in the surface, which isn't harmful. However, layering multiple hyaluronic acid products may be redundant. One good serum is usually sufficient. Does it work immediately? You'll notice surface hydration almost instantly. Your skin will feel more supple and look more dewy within minutes. However, deeper, more significant improvements in skin texture and fine lines require consistent use over several weeks. Can it replace moisturizer? No. Hyaluronic acid is a hydrator, not a moisturizer. Hydration refers to water content, while moisturizing refers to preventing water loss and replenishing lipids. You need both for optimal skin health. Is it safe during pregnancy? Yes, hyaluronic acid is considered safe during pregnancy and breastfeeding. It's a naturally occurring substance in the body, and topical application poses no known risks. As we close our time together, remember that hyaluronic acid is one of skincare's true heroes, a gentle, effective, universal ingredient that simply helps your skin do what it already wants to do: stay hydrated, plump, and healthy. It doesn't force dramatic changes or cause irritation. It simply supplements what your skin naturally has but loses over time. This is skincare at its best, working with your body, not against it. Take a deep breath in and release it slowly. Consider how you might incorporate hyaluronic acid into your routine, or if you're already using it, appreciate the gift